Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is a rosebud not blooming. A rosebud not blooming. For many years, I maintained a personal rose garden. And I was never troubled by a leaf of the rose bush turning yellow here, or a rosebud not blooming there, or a twig falling off on any of the plants. I was primarily celebrating the colors of rose flowers. And of course, I was also focusing on the sandy soil which needed to be watered frequently. And I had learned earlier on that roses do not do well unless they have ample sunshine. So it's a mistake to plant a rose bush on the north side of the house. I'm talking about the northern hemisphere. And then that led me to some reflections on how the health of a rose flower depends upon the quality of the soil which nurtures the root system of the rose bush. There's a companion article on this encyclopedia, The Garden. Please watch that. I bring this up often with my patients during my clinical visits, because it is natural for a person to focus on describing their particular symptoms or symptom complexes. While in the sun soil model of health and healing, the bowel, blood, and liver represent the unit of soil and roots. And the spiritual equilibrium, ethical equilibrium, freedom from anger and fear represents the sunshine. So I'm trying to visualize where the symptoms might be coming from. Is it fermentation in the gut? Is it fermentation in the blood? You can see that with microscope. I have published a very large number of photomicrographs. What I mean by fermentation in the blood, which means microclot and microformation in the blood, which impairs the liver's detox potential. And of course, when the blood is acidified and it is microclotted and microplaqued and thickened, it cannot provide the necessary nourishment and oxygen to the brain. So the brain cells get free radicalized. But it is very human for the patient to stay focused on and be repetitive about describing the symptoms. Now I have to pull them out of that model of obsessing on the symptoms to the model of how can we correct it. There's another program where I say, raise 3 questions. What is it? What caused it? What can I do now? And this is when you have symptoms, whether it is acute anxiety or whether it is you wake up in the morning with a shoulder pain or with sciatica. You have enough time to think about what is it and what is the cause of it. But when you think about what can I do for it, you empower yourself. And there is a very large number of natural remedies that I offer on this encyclopedia, especially castor sesame oil drops, hydrogen peroxide foot soaks, Dr. Ali's breakfast, Dr. Ali's anti-anxiety or panic attack or panic control protocol, Dr. Ali's gut fermentation control protocol, Dr. Ali's insulin reduction protocol. So I give this analogy to my patients to tell them, I would rather stay focused on the flowers which are blooming and be spiritually uplifted by the celebration of their colors, And if those colors are not fully gratifying, then I would rather think about the soil, the nutrients in the soil, the water in the soil, and of course sunshine. So a rosebud that's not blooming, a rosebud not blooming, what can it tell us about the human condition? Well, a lot. What can it tell us in reversing chronic disease? You guess it. What can it tell us in regaining our optimal health so we can grow gracefully, healthily, productively, free of fears and anger? In acute illness, you really do need to see physicians, and you need diagnostic technology, and you do need drug medication intervention, sometimes surgery. I one time did an autopsy on a boy who had died of ruptured appendicitis, and another child who died of asthma attack. I bring those images into this picture just to make a clear distinction that the requirements of acute illness are very different. You must not really think about the sun-soil model of health and healing if your child is acutely ill, or if you yourself are acutely ill. But once that issue has been resolved by your doctor, then you come back to the Gardner model of thinking. Please watch that second companion. You will see some redundancy, but that is planned. My purpose is to deliver the message that rather than be obsessed with the bud that is not blooming, I want to feel and experience the bliss of the flowers that are blooming, while I'm mindful of the conditions of the soil, the root system, the hydration of the soil. Remember, rose bushes do not like stagnant water in their roots, nor should people have stagnant lymph in their legs or in other tissues. Our vision at this encyclopedia is to provide authentic information untainted by corporate collusions, free of cost, easy to reach, simple to understand for people of all backgrounds. I use these analogies because I want to reach the viewers. You can support our vision, forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contact should you wish to do more. Please visit my website, majidali.com. You can order any number of my books, 27 are available, any number of my video seminars, more than 60 are available, and that would be one great way you can help us take this message of hope and healing to all regions of the world. Until you meet again, may you be gracious, graceful, and generous in your spirit. Thank you.